This is now nice and soft.
There's still some little frizzy bits,
that's
but
still hard.
But by the time you get to them, if you spread them out, or I would just sit it in the sun at the door while you.
Yeah.
If you're,
that'll be alright. For what we're going to do today, that'll be perfect.
Okay.
Yep.
Yeah, thank you very much.
Okay, hit play, Paul. Hit record.
It's recording.
Oh, it is it?
Assume it's got sound and everything. Yeah, go for it.
On?
Yep.
Alright, what I'd normally do when I had this for the kids is I'd be talking to them about the ethics of it. So I'd go, you know, the fact that these animals haven't been cut for our purpose, they're actually as part of the normal food process, and the fact that we need to treat them with respect, and otherwise we actually can't do them. And in actual fact, there was a university over in Sydney where they actually have lost the right to do dissections because of how some of their students were treating the parts of the body that they were using. All right.
So the animal's already killed and gone off for meat or whatever already?
Yeah. And the same thing in terms of the heart, and I do that sort of talk before we actually come in to do the dissection. All right, so what we've got here, just trying to orientate it now, and you can see they've sliced it open pretty well, is we've got lung, we've got heart, we've got liver. This one hasn't got a very, lots of fat in here, all right, which is a really important energy storage. We sort of think of this as useless stuff, but it's actually like an organ. It's like an organ. We actually need to store that fat as it's to get us through the hard times. So we talk about that stuff too. This is some smooth muscle here. See the difference in terms of what that would be like for like a bicep muscle. I'm just trying to orientate. That looks like our small this way. Okay, you can see they've put these slits in here. They actually need to do that to, and same in the heart. They actually need to do a check through the. They actually need to do a check to make sure that it's not parasite ridden. So they'll do that as part of the at the abattoirs. And the other thing is to really notice how in close proximity these are. So hence why one side of the heart will be very small because it's only pumping from there to here, whereas the other side's pumping all the way out to the rest of the animal. And also the fact that the liver is in such close proximity too, because it's such an essential organ. Without a liver, you don't live. So you're producing really key enzymes. You're removing toxins from your body, and also producing digestive enzymes. So really crucial. There's not much to see in there. So what I'd normally do is we'd remove that out because it's not. And if I have time, I'd come to that afterwards. So that can go back into the into our board there.
And cut that as well.
Yeah. So a lot of those cuts will just be because they have a time frame as this animal moves along the production line. Okay. We haven't. Sometimes I've had some where you've actually got the length of esophagus on there as well, so you can actually see the cartilage rings. You may or may not get that, but you can actually see them. You can actually feel them there. But you can see the cartilage. And so what I'd also talk about, the kids, they might have heard about tracheotomies, and the fact that what they actually do in that instance is that they make an incision between the cartilage, and then they put some sort of breathing or mechanism through there.
Like in the movies where they stick the pen.
Yeah, that's the one. Yeah. And somebody who's had throat cancer might have one of those speaking machines because the air is actually not going past their vocal cords, or the vocal cords have been cut out. Alright, so then we're onto the lung itself, and we talk a bit about how there's two lobes to the lung. We talk about the close proximity to the heart, because obviously that's the key area. We look at the shape of the lungs, the fact that there's lobes to the lung, so this is also another part of the lung here as well. Alright, and the fact that sits within the chest cavity and is then held within a pleura, a bag, so that it's lubricated. You imagine that expanding and contracting inside your rib cage, it would soon wear out because it's quite a soft and spongy tissue. From there, what I'd be doing at this stage is I'd actually probably separate heart and from this. I might use scissors for this rather than use my fingers. Pop that back in there so that we don't lose it. So I try to, whenever the kids are dissecting, if they're using scalpels, oops, that's probably better here. I like them to use dissecting scissors because they'll have more control over their cutting.
And cutting's only with a cutting board underneath, sort of.
Yeah, they would be cutting with a cutting board underneath. So that's part of blood vessel. So try and remove the heart.
Pulmonary artery there.
This one, you can actually trace that back afterwards. I'll get this separated eventually. See, I'm trying not to take too much of the lung away. Alright, so there's our heart, and we can have a bit of a look at that. This is just connective tissue here. And then you've got your various arteries and veins. But we'll have a look at that in a little while. Let's have a look at our lungs now. So we've got our lungs separated. Alright, and so down here is the tube which is coming down into their lungs. So this is their esophagus here. And then it's branching off into the bronchial tube that it branches off to each side. And that's cartilage. You can notice that that's cartilage all the way down through here. Alright, so that's necessary to keep that structure held out in position as opposed to allowing it to kink shut. Alright, from here I'd actually look for people to come in and would have a sample of straws here, and they'd actually be able to come and try and inflate the lungs. I'd give it a go first, and then I'd let perhaps one of the kids have a go. The key is you need to talk to them about the difference between blowing and letting the air come back through you, so not just sucking it back, but if you stop pressure, the lungs will deflate and push the air back into you. So you don't want that to happen, so you remove your straw and mouth
at the same time
after pressure, or you can leave the straw there but just remove your mouth. But you get a one-shot go then. Trying to pick a part of the lung where there's not too much damage. I think we might use this side, and what I'll do is I'll just poke that down into the bronchial tube, and then I'm going to need to, if I can, seal that off around there. Alright, and then from there we'll just see if we can get it to inflate. And you can see there that we've got quite a bit of inflation there through the heart. Now that'll actually, there we go, I've pulled my straw out and that's deflated, but now that's actually more spongy than it was before. Okay, so, and it's quite difficult to get the lung inflated the first time, which is, you can also talk about there, how difficult it is in terms of deflated lungs or collapsed lungs. And they'll all know about the footballer who had a collapsed lung. And even link it back to the concept of trying to inflate a balloon that you've already blown up, which has got wet inside from your saliva or something like that. It's really hard to get the sides of the air passages or the alveoli to start to expand, to pull away from each other. So this will be much easier the next time. So also we can get a bit more inflation. It's about all we're getting there, but you can see how that's really changed as the lung has filled up and inflated. And you could try going into different parts of the lung. These upper lobes up here, if we can get one of these to inflate, it's quite good. Nope, not getting anything there. Try the other side. Yeah, you'll actually see it'll go quite big, like a huge balloon. We'll see how we go. No. Just the difficulty is as you're trying to pinch it off, you actually block it off.
Mm. That's good. Yeah.
So there we go, we've got that well inflated, yeah, and you're starting to get that lung shape.
Mm.
So all those air passages are pulled away from each other and those alveoli are now all full of air. And also in there would be a really strong blood supply. So that's quite significantly inflated now.
Mm.
And we talk about, you know, what's going to happen if you break a rib and it sort of punctures into that area. Well, you're going to have quite significant leakage in that area, so we can actually simulate that by putting a nick in our lung, and we'll actually start to get air in that area deflating, and you can see it's deflating around that sort of line, whereas these alveoli don't feed into that, they feed back out through this way, so it'll take much longer for them to decrease. Alright, so that's pretty, you know, I mean, that's stuff that's pretty cool to have a look at in terms of how that goes. Then what I'd be looking to do, so, you know, a couple of kids will want to have a go at that, to blow that up, and after 3 or 4 have had a go, that's probably more than enough. Yep. The other thing to warn them about is that you're actually trying to maintain pressure, so if you've got anybody who's asthmatic or has breathing problems, you wouldn't want them to perhaps be someone to volunteer for that. Yep. Or epilepsy or anything along those sorts of lines. Alright, then the next trick would be vegetarian? Yeah, probably. Would be to come down along the bronchial tubes as far as you can go. So dissecting along those and actually seeing how far you can get and what's happening to the size of the bronchial tubes. You can see this, look at the difference in the tissue now between so this hasn't been inflated and this one has, so it's stayed more like a plumper because there's still air inside the individual alveoli, so there'd be, you know...
Because it's so fine. Yeah,
we're talking really fine down in there. So this is still going along bronchial tube, and you can even see right down here we've got quite small, but we're still looking at cartilage as we come along there, and this will actually extend right the way in. And so we're going smaller and smaller and branching off until we sort of can't go any further. So that's about the end of the cartilage all the way down out here, and then you can actually trace it out along individual bronchi, so we can see what's out this one, and again we've got more branching and more cartilage as we come out. So, you know, ask the kids what sort of reasoning are we going to have for that? What's the purpose of having this all the way out along the tubes of the lungs? What would happen if you didn't have that? What might be a likely scenario? And what's going to happen if you are producing lots of phlegm in that area, so you've got a really bad cold? What's that going to mean for being able to draw air into this area? What's it going to mean in terms of if we think of this as being made up of sponge tissue? What's that going to mean if we're asthmatic and those air holes are actually swelling and constricting off? How might that be an issue? And if you think about how hard it is to blow up the lung, imagine trying to... It's effectively the same when the lung's trying to inflate, and yet the walls of the alveoli are like constricted and held together.
Yep.
Yeah.
What about smokers and those who live in polluted cities?
Yeah, that
just gets jammed down there, doesn't it?
Yeah, well, once it's in there, it's in terms of getting it out, that's a really difficult process. In actual fact, we've got a whole heap of cilia along. Well, we've got the hairs in our nostrils to first capture larger particles, and then we've got the cilia down our throat, and then we've got a coughing mechanism where we'll cough. When we cough, we contract this rapidly by the diaphragm pushing up, which puts pressure on the lungs, which then encourages air to come out in a rapid spurt. Yep. And then most often what we'll do is that'll come up and we'll swallow that. So more often than not, we're actually swallowing that sort of stuff that's trapped there. Also what our cilia traps.
But we end up through a lifetime though, you end up collecting...
Eventually you collect, yeah, and we saw that in that human body exhibition where some of those lungs were actually, I think they had one where they showed the difference, yeah. And if you go in, you can see tumorous cells, or you can see they'll do a cross section of a lung, and instead of being this is relatively pink, as you'd expect for an organism, for sheep living out in the paddock props, but you'll have more dark flecks in there as the soot and tars and rubbish gets caught deep inside this tissue, and it really can't get out. And that's where that new field of nanotechnology and nanocarbon fibres, that's a concern. If these things are so small and yet so strong, they'll get in there and not break down. Yeah.
Mm-hmm.
So that's pretty much, a little bit better if you can see more of that esophagus as it comes up through here, but it's just the luck of the draw in terms of what you get. And then this is just connective tissue here again with more fat on it, I think. It might be part of no, just connective tissue with more fat. All right. So that'd be pretty much it. I might, if I've got a lung that's inflating well, that hasn't, because that's the original cut. Sometimes you'll get them with just a nick on the side and nothing down here. And you'll actually be able to inflate that whole bottom lobe. And then we can try inflating it again with the bottom bit snipped off, and see, as you try and inflate it, it'll come up, but then the air will just force it into that gap. And then I'd talk about air being inside that pleural sac, and how it's actually, hopefully by this time you've already talked previously about the fact that inspiration is you're not sucking it in, it's a low pressure, and it's air being pulled in.
You're opening up, yeah.
So that's pretty much it.
If you've got air around the outside, then you're not going to be able to open up your lungs.
No. So I would have already talked about that when I did the bell jar, and then we sort of relate that to this. So that's pretty much it in terms of the lungs. It's not a big dissection. It's more about getting across that concept of what the lungs actually look like, how they inflate into that lung area, the fact that they're covered in a pleural bag, which you don't get, but and so this is lubricated. There's extracellular fluid around that as well, and pretty neat sort of mechanism. And the fact that the heart's really in there, really close, and that sort of concept.
Now these would be about this size.
What's that?
Like a 13, 14-year-old kid.
They're probably pretty similar.
A bit larger perhaps.
Because I don't know what the weight of sheep are. Probably about 40 or 50 kilos. So probably
I'm
talking.
guessing I was going to say
pretty similar.
Yep.
All right, we'll just have a quick look at the liver in terms of what you might see through here. This will have a very strong blood supply, because all of your blood at some stage goes through the liver, hence its proximity. There's actually not really much to see. It's got different lobes. It's the largest internal organ in your body, so bigger than your heart, heavier than your lungs. It's got more mass to it. In terms of what's in here, we can just slice that through just so that the kids can have a look. And basically there's just, these would be blood vessels through here, okay, and it's just, the blood just courses through this whole area, and it's really just a huge chemical factory. So when you drink, when your parents are at home drinking alcohol, that's a toxin. It produces an effect in your brain, which is possibly the effect that your parents are drinking for the enjoyment factor. But it's also a toxin, and it's your liver that has to break it down. And so that's why, when they talk about 4 drinks in an hour for a male to break down, that's because that's the maximum rate that the liver can break it down. So if you have 2 drinks in the first hour, if you have 4 drinks in the first hour, by the end of the hour, your liver will break those 4 drinks down. If you have 8 drinks in the first hour, by the end of the hour, you'll still have 4 drinks worth of alcohol floating around in your system, because the liver simply can't keep up with that. And then if you bathe that in alcohol all the time, so you're giving it more than it can get rid of, the liver will actually start to get damaged.
Overloading it.
And so then you'll get, the other amazing thing about the liver is, because it's so important, it's actually got a self-fixing feature, so it will regenerate. So you can damage your liver as long as the damage isn't severe enough, a bit like when you graze your skin. It'll replenish itself, but if you're constantly damaging it, it'll actually, one of the symptoms of a damaged liver is it'll enlarge. So it'll have so much damaged tissue that it won't be replacing, it'll just be trying to put new tissue around it. So, cirrhosis of the liver is essentially an enlarged liver, and it means a lot of the liver will be dead. And again, you would see, after the fact, you'd see that change of colour in this liver. Another feature that's people who are overweight, they talk about this liver being a fatty liver. In actual fact, their liver won't look nice and pink, it'll look white, because in actual fact there'll be a whole heap of fat. Your liver's also responsible for breaking down and getting some of your liver stored, your fat stored. So you'll actually have fat stored in your liver, which is not what you want. You want it stored in your fat stores.
Again, you're overloading it, sort of thing.
Yeah, and it just simply can't deal with it.
Yep.
Also, the other thing that your liver is really responsible for storing is it's a big storage of sugar, of glucose. So if your blood glucose level drops, insulin gets produced, and it will, other way around, it'll produce glucagon, which stimulates your liver to produce more, to release glucose that's stored in here.
Yep.
So if you're carbohydrate loading, you'll be storing a lot of glucose in there, so as an athlete.
Okay.
Alright, so there's a bit to think about there. Now this is your heart dissection. I would tend to, still a bit solid, when and if you, I would tend not to really spend a fair bit of time talking about this as part of the dissection. That's your next lesson.
Yep.
So I would show them actually how they're going to dissect next lesson. What I would do during this lesson is I'd do 2 vertical cuts through here and lay our heart out and just have a bit of a quick look at the heart, just so that we can see where we are and sort of orientate it.
You said for the kids they're going to slice it?
Yep, I'll just show you how I would do the heart dissection with the kids. Could you get the cutting board out for me? Okay, so what we've got here is our heart. First thing the kids need to be doing is they need to be looking at the heart before they start cutting it. So the fact that there's actually blood vessels around the outside of the heart, which are taking blood to the muscle itself. The heart doesn't get any nutrient or oxygen value from the blood that's inside. I mean, it would, only those cells that are touching it, but it actually has its own external blood supply. Then you can think about, somebody might have heard about somebody having a stroke, or a heart attack, sorry. So if you shut off this major blood vessel coming down here, if you blocked it there, what's that going to mean for all of this part of the muscle that's being supplied with blood from along that blood vessel? Well, this part of the heart's going to start to die off. Of course, there's more than one way that blood can get to an area, so we've got more blood vessels coming down through here, so some areas will be worse affected than others. And the more quickly you can get to hospital and get some blood thinning drugs and what have you, the less the damage will be to the heart. So again, I'm assuming now that you're actually coming in for your heart dissection. The other thing I'd be looking at is trying to work out which blood vessels are which. So in terms of, this is certainly artery here, and you can see how really thick and strong and like a high pressure hose that is. Also a really large diameter. This one here will be a vein. Right. Much thinner, doesn't need to take blood at such pressure, it's just sort of draining into there as opposed to coming out under high pressure.
And there'd be another pair on the other side.
Yeah, actually it's easier to work out what's what once you've got it open, because then you can trace in and out. Okay, in terms of the kids' dissection, what I'd be getting them to do is, using their scalpel, is taking off about centimetre pieces along the bottom of the heart. Okay. And we can start to see that we're starting to get one of the ventricles of the heart down here. So you're just starting to see that, and I'd lay that out on my sheet of blotting paper here. I tend to try and get the kids to keep their equipment in their kidney dish, and then so the next one you might come through here again. If they get some blood leakage, that's normal, particularly if the hearts are only freshly thawed. Sometimes they may even get congealed blood inside there. So that's a bit of the heart that got damaged off. Alright, and I try and orientate this, so we've still only got one ventricle at the moment. Alright, so we'll lay those down and then just keep going. Again, trying to be about a centimetre. Got our fingers well away from where the scalpel is. Okay, now we're starting to get the second ventricle. You can just see that over here, and you can see the thickness of the wall. So all of that is one side pumping out to the body, and only this bit is pumping to the lungs. So significant difference. So the kids can keep doing that, and I would show them very quickly what I want them to do after they've done their observations, and then I'd get them cutting off these discs, and I'd say aim to get about halfway up the heart. So it just becomes more obvious in terms of the significant strength of one side of the heart versus the other.
Yep.
And we'd probably go maybe one or two more here. Maybe this one would be. It's a bit crunchy in here. So hopefully our hearts will be a bit more. All right. We can see we're starting to get some. That's actually frozen blood as opposed to congealed. These are pretty fresh, I'd imagine. All right. And I would talk about the septum in between the chambers of the heart here, and what's going to happen if you get a hole in the heart, and the fact that you can have micro holes in there, very, very microscopic holes in there, and you can actually live quite well with those, so that you'll just get some pressure loss between when the hearts beat, and you probably won't notice that until you actually try to become an elite athlete. But other people will find that that's a significant problem very early on. Often they'll pick that up on the ultrasound. They'll be looking for blood transfer between the chambers of the heart, which shouldn't happen. So from here, what I'd then be looking at, this is a bit crunchy, is I'd be starting to think about here is actually, no, we go a bit higher. We might just take our scissors and cut up vertically through the sections of the heart. So orientate our heart. And we'll do this one. So just up here into the atrium.
This is the right one?
This would be right, yep. I've sort of got the heart orientated as it would. There we go. And then we'll do this one as well. Actually, sometimes it's better if the kids cut it all open, then they lose where it all goes.
Yep.
All right. Now, normally, if this was a bit more defrosted, you'd only maybe get a little bit of this congealed blood. So don't let them get all turned off by that. So this is atrium here. This is ventricle from here down. So most of the heart is ventricle.
Okay.
All right.
Bottom part.
So from my finger down.
Muscle.
Yeah.
Yes. Yep.
So that huge squeezing to get blood out.
Yeah.
And you can see how thin the upper walls of the atrium is, because all that's got to do is contract to bring blood from there to there. So it's looking at a pumping distance of that far versus from there to the lungs.
Yep.
Yeah. And then this side is obviously going to the body. The other thing to look for, so I'd have got the kids to do that and lay them out, and I'd show them the discs. I'd draw the discs on the board and show. I want you to lay it out. Then I'd bring them in and talk to them about those discs and really significantly talk about the difference there.
Yep.
But I would have been circulating around the class. Then I would have my heart to this stage, and I'd say, okay, this is the next bit I want you to do.
That's right. You get it backwards and forwards.
Yeah.
Yep.
You don't have to do that, but that's I like them to. It's sort of a lockstep method. So you do this bit, look at it, and then I want to talk to you because there's lots to tell.
Yep.
Whereas if I tell you all at the start, you'll have no idea.
It. Yeah.
The other thing I want you to start looking for at this stage is the valves, and that's where I normally get my fingers in there. And you can imagine, so blood would come in through a blood vessel. We can find that. So there it is there. What vessel would that be?
That one, that's the left side, so it's coming back from
the body?
The body, so that's the vein.
Vena
Oh yeah, that's got
cava.
Yeah.
Vena cava, good Paul.
Yeah, that's it.
So that's the main vein coming in from your body. So all of your blood is leaking into there from your legs and your arms and your head. So there'll be different branches coming up from different areas. So here's the blood coming in. Comes into this top atrium, and what it'll then do is it will basically, there can be a small bit of contraction here, and the blood will come down into the ventricle.
Yep.
Then when the ventricle's ready to squeeze, some blood will try and come back up into the atrium.
Yep.
And then if you have a look, and you can do this when you go back to yours, some of the blood will get trapped under that flap, and that's actually what we call a valve.
Okay,
right?
You've cut it right next to the valve.
And so the valve will be around here. There'll probably, I think from memory there are 3 parts to it. I'd have to check up on that. So, and in here you'll actually feel the valve strings, very much like a parachute. Okay, so right up in there, they're still a little bit frozen. And you can see how strong they are. So if blood tried to get back up into the atrium, which is from here up, it really wouldn't be able to do. They would flap and cut across. And that's actually predominantly what you're hearing when you hear someone's heartbeat. It's actually the valves going
opening and closing.
Yeah. Okay, so they can see that. They can actually try and see how strong those valve strings are. You can talk about maybe artificial valves in the heart, how they've put that's been something new. All right. So that's pretty much from that side, and then I'd send them. You know, they'd be off and doing their business. So now we'll go to the left side of the heart, or the right side as we're looking at it. And here we have some significant muscle, and again, because of the high pressure for that side, you've got a significantly improved valve as well.
Yep.
All right, and some quite significant valve strings. And remember when I was telling you about that? They're the ones that got stuck.
Yeah.
So again, at this point, I'd be looking at where is the blood coming in, where is the blood exiting. So this one here looks like it's the major exit one, and we can see the significant width and strength of that, and they can actually try stretching that. Mm-hmm. One of the things is to actually do that. See if you can actually, how far can you stretch that if you can, and it's quite tough. Mm. I should probably let you. Do you want to touch it or?
Yeah, I'll have a play.
Okay. And then I'd be looking for where is the pulmonary vein. So where is it bringing oxygenated blood in? And that's it there. Okay. So you can see it comes down, and the valve actually opens really easily as that blood comes in.
Yep. So it's just like flowing in.
Yeah. So in it comes. This is actually the atrium here. Mm-hmm. All right. So we've only just got the very top of the pulmonary vein, and that is actually heart muscle. That's the atrium, because all it needs to do is go and force it down into that bottom part, into the ventricle. All right, do you want to have a feel with that?
Yep. Might have to play with that. I'm conscious of the fact that Subway just delivered my kids' lunch.
Oh, okay. Yeah.
I have to go in a minute.
So the idea of doing that disc for the first bit is just to see that significant, because I think it's quite significant to give the kids the concept of how the form of the heart follows the job it has to do.
Yeah, hasn't got much of a capacity, really, has it?
No, but you'd expect that to actually be able to expand quite a bit. Remember, this has been frozen and defrosted, but no. It's not huge capacity, it's just, and so therefore it's beating often.
And that's your off to the body.
Yep.
The first bit off to the head is that main one that comes off the top.
It'll actually branch
up to the arms one, and then the one that goes down the back.
Yeah.
Towards the feet. Yep. Yeah, I reckon I can get a good session out of this.
All right.
Yep.
So I sort of wouldn't be worrying too much about the heart during my lung dissection. I think that's
just getting it ready for the.
Yeah. But you could do just the 2 vertical cuts down the middle, just to show them. And this is the internal structure of the heart, but we'll leave that till next lesson. And then, as I say, there's not much in the liver. The lungs is interesting, but I think part of it is all the stuff you've got to tell them as well.
Yeah.
All right. And then for
I'll see if I can get the disc and watch this over the weekend again.
All right. And then the pack up. Well, you can actually. Yeah. Pack up would be that. Normally I'd have, instead of this, I'd have blotting paper, you know, the paper towel.
Yep.
So I'd get the kids to remove, number one, they've got to count all of their equipment, just like the surgeons.
Yep.
And then number 2, they've got to wrap up their all heart pieces in the paper towel, and then that goes into and that'll be a bucket out the front somewhere where that all goes in.
Yep.
And then the rest of the stuff gets put into the normal bin, and we'll package that one up as well.
This paper.
Yeah, all of this can go in there with your gloves and all that sort of stuff.
Yep.
Alright, so that can go in there. Beautiful. And we'll actually get rid of all of our stuff in there right now. And because if they peel down from the top, they should be pretty straightforward in terms of making sure everything's clean. One of the other things is I'd be talking to them very strongly at the start of the session. I'd probably spend quite a few minutes talking about behaviour.
Yeah.
And how if you're not doing the right thing and you know what the right thing is, then you're actually not going to do any experiments from here, and you're not going to do any in the future. So the fact that our ethical license, our ability to do these experiments is based on the fact that we're going to require good and appropriate behaviour from you. So just really bring that point strongly home at the start, and there really shouldn't be any problems because it is interesting.
Yeah, no.
And if the kids say, can we just cut it up? I say no. You have to actually have a reason for doing what you're doing. If it's something different to what I've told you to do, then you need to ask me before you do it. I'm happy for you to find something and want to know more about it, but I'm not happy for you just to cut it up.
Yeah.
Alright?
Yep.
Easy.
Mm.
And then I would...
Do you just leave that, or do we actually clean it up?
We'll leave that for Joan. And then there would normally be disinfectant spray for the bench. And even though we know the bench hasn't received anything on it, the benches get done. And then there's normally, well actually now we've got antibacterial soap, so they just all wash their hands anyway. Again, even though we know they've had latex gloves on. Yeah. So done.
Cool. There's
That's off.